There's a mask on this mouth. There's a mask on this mouth. There's a mask on this mouth. There's a mask on this mouth.
I said safe and chic, 7 days a week. Wear a mask, please. Make that COVID curve weak. Ooh, yeah, 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 yeah. Yeah, I'm asking that you wear a mask, please. When you're out at a shop, you've got to wear a mask, please. Don't just hold it like a prop, you've got to wear a mask, please.
Put it on, let it match your clothes. Rock the science with the pose, with the mask right on your face, so it covers your mouth and nose. Let the doctors be your guide. Block all the droplets, keep them inside. Wear it secure, not left untied. On your chin, can't let that slide. Curves to spread, can't be denied. Wear a mask and do it with pride. I want you to put that face mask on right in front of your schnoz. It's not cruel, don't be a fool. Out in public, it's a rule. I don't mean to ridicule, but let me take you all to school.
No squabbling, bothering, please don't deride me. Quick mask up, give me 6 feet beside me. I'll show you how to wear it, even though it should be easy. I'll run real far for just too close to me. Get a test if you're sick. It's not that bad and super quick. If you're positive, don't be afraid. Just isolate to keep others safe.
Now get your water and your soap. You've got to wear a mask. Please don't take it down just for pictures. Got to wear a mask. Please can't have transmission. Don't dismiss me. Got to wear a mask. Please now don't complain, cause I wanna see you wear a mask, please.
Yeah, yeah, yeah. Yeah, I'm asking that you wear a mask, please. When you're out at a shop, you've got to wear a mask, please. Don't just hold it like a prop, you've got to wear a mask, please. Now from the hop, it's a bop, saying wear a mask, please. When you go out to the shop, you've got to wear a mask, please. You've got to stop, 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 and just wear a mask, please. Don't just hold it like a prop, you've got to wear a mask, please. Huh.
What is up, y'all? My name is Andru Defeye. It is 8:08, and I am the Gorilla Poet Laureate, the Hoodie God, Zaddy Elastic Pants, aka I will cook and eat a full course meal all up in the Zoom room without even putting myself on mute, aka I wear my sunglasses at night indoors because my eyes are as sensitive as my heart is, y'all. And we are back with the first episode of Masked Up 2.0. Thanks, Mindy. Appreciate you tuning in. See a lot of people tuning in. Go ahead and share this right now. We are here for the first episode with our new sponsors at ProtectUS. We have partnered up to do some really cool work. The show has changed a little bit. We are now a community health live stream, and we're going to be covering all kinds of things, including some COVID news, including the latest health news and studies for you, including racism as a health crisis. We're going to be going deep on this here live stream, and we have an incredible guest tonight. We got a couple of them. Couple of legendary folks. Crystal Strait is going to be joining us from ProtectUS to talk a little bit about the organization. And we have the one and the only Dr. Richard Pan coming through tonight, y'all. So stay tuned. Make sure you share this. And we gonna get the show started right now. I think before we even start, as you can see, I got a new studio here. We've got dancers. We've got some new graphics going on over here. It's a big thing. It's a big thing that we're doing. So I want to bring on, someone to tell us a little bit more about ProtectUS and about what is going on with ProtectUS. So without any further ado, I'm gonna bring Crystal straight onto the stream, y'all. What's going on?
Hey, good evening. That was awesome. I love the new graphics.
Yeah, this is all y'all. You know what I mean? We got some. Crystal told me I could have whatever I wanted to, so I got a new studio. We got some new graphics. I asked for dancers. We got dancers, y'all. Like you will see them later on in the show. It's gonna be fantastic. So. Tell us a little bit about ProtectUS. Like who are y'all? What are you doing? What's the mission?
Yeah. So thanks, Andrew. I know you're gonna have Dr. Pan on later on, so he'll explain more of this. But probably 10 years ago, Dr. Pan and I really talked about what his vision for community health was, and it really always comes down to building healthy communities and empowering people. And yet at the same time, what we've seen, particularly last year and even in the first days of this year, that a lot of people don't feel empowered. There's a very vocal minority. I really strongly believe they're a minority that want to dominate the conversation. And so I think Protect Us, we want to be a grassroots organization that really helps and empowers people to speak up. We recognize like we need you, the silent majority, to speak up about public health. But you can't speak up until you feel comfortable, right? Until you feel educated, until you feel empowered. And so while I watched you this last year use COVID as a way to interact, particularly with the art community, I really felt like you would be a great conduit for us to create a new space for people to learn about public health, to talk about public health, to ask tough questions, and really use COVID as a moment. Not that we're trying to get through it or over it, but recognize that COVID actually is a lens into a lot of big problems that we haven't dealt with.
So what's the most exciting part of partnering up on this live stream here, other than the dancers? We're both, I think, equally excited about the dancers. So what's the most exciting part for you?
I think the exciting part is, while I've worked in public health quite a bit, with Dr. Pan over the years, I've worked in with against a lot of anti groups, anti-vaxxers, anti-abortion, anti-5G, anti. What I'm hoping is that this space can be that brave space so that we can have tough conversations. And a lot of times we get into the middle of the fight and we're in it and we can't really take that step back to have the talk, right? And so hopefully, again, this isn't the end all be all of it. We'll have lots Protect Us. We'll do lots of different projects, have lots of different conversations, but I'm the most excited about this and launching this first so that we can, show how people we're serious about this.
Yeah, I'm really excited to have a space to be able to talk about community health. And, this is an interactive show where people can kind of comment in and ask their questions. If they got questions for our guests, for myself. And again, I'm not a medical professional. I'm working with the team at Protect Us. So being able to, I can take some of those questions back and get some answers. I've already found some really amazing things out just in talking to Netta in the background of what's going on in some of these new medical studies. So I am thoroughly excited to have y'all coming on as a partner to the show. And here we go. We're going to do this right now. You ready for this, Crystal?
Thank you. We're really excited. Thanks so much, Andrew.
Absolutely. All right, y'all. So you heard a little bit from our new partners over at Protect Us. And like we always do at this time to start off the show, this is the weekly Rona update, y'all. So this story comes to us from Michael Mago of the Sacramento Bee for this week's Rona update. California's official coronavirus death toll is closing in on 30,000 and closing in on it rapidly as COVID-19 fatalities pour in at their fastest pace yet of the pandemic during the state's unrelenting surge. The state reported a record high 695 deaths on Saturday, followed by 468 on Sunday and 264 on Monday, driving the two-week total to nearly 5,700. That's an average of 406 new COVID-19 fatalities per day, more than 6 times higher than the 14-day window just before Thanksgiving. The brutal surge of infections, hospitalizations, and death first took hold in California around early November, and it has not let up, y'all. Since November 1st, the 2-week average for daily new cases has exploded from about 4,300 to nearly 40,000, according to the California Department of Public Health. The percentage of diagnostic tests returning positive has more than quadrupled from 3.2 to 13.7%. Let me say that again, y'all. The percentage of diagnostic tests returning positive has more than quadrupled from 3.2% to 13.7%. The concurrent total for hospitalized patients with confirmed COVID-19 has erupted from 2,500 to nearly 22,000 as of Monday's state data update, with the number in intensive care units growing from 700 to almost 5,000. The result is an ongoing hospital crisis consuming vast portions of the state. CDPH has reported San Joaquin Valley and Southern California both at 0% ICU availability for more than 3 weeks. And some health systems in those regions have been entrenched deeply in what the state health chief, Dr. Mark Galey, calls crisis care protocols, rationing oxygen, staffing, and other resources in response to swarms of COVID-19 patients. The situation is not yet as dire, but is deteriorating in 2 of the 3 geographic regions, rounding out most of California's population of 40 million. The Bay Area plummeted to 3% ICU availability as of last Friday, and Greater Sacramento, which had hovered around 15% threshold for most of December, has dropped to 6.4%. State health officials did not update regional ICU availability over the weekend, so we are still waiting on those numbers. In the capital area, over here where I reside, December has already become by far the deadliest month for COVID-19. At least 319 Sacramento County residents died of the virus last month, which is 138 more than the previous worst month of August. To date, California has reported more than 2.7 million lab-confirmed cases of COVID-19, with at least 29,965 having died of the disease, according to the CDPH. So it's not looking good, y'all. Like we are on a not so hot trajectory. So, you know, we asking everybody to like continue taking those precautions. We know that the fatigue is real. But we gotta stay active in trying to ward this off. So, you know, keep that social distance going, keep washing your hands, stay in and away from folks as much as possible. And let's get this curve under control, y'all. I'm trying to go outside again. So we also want to talk about, you know, there's a lot of news around the vaccines. So the latest vaccine progress, this also comes to us from Michael Mago, Sacramento Bee. California remains in phase 1A of the COVID-19 vaccine rollout, meaning shots are still being given to frontline health workers who deal directly with virus patients, as well as in skilled nursing facilities. It's been an uneven process, Governor Gavin Newsom said in Monday news conference that about 2.4 million doses have been shipped out to local health departments and hospital systems, but only about 783,000 of those shots have been administered so far. State health officials in the middle of last week stated a goal of administering 1 million vaccines in 10 days. Through day 4 of the 10-day sprint, California had administered about 295,000 of the 400,000 it would take to stay on the million-shot pace, according to CDPH's online vaccine tracker. 2 vaccines for COVID-19, one created by Pfizer and BioNTech, the other by Moderna, that's BioNTech, I should say, and the other by Moderna, received emergency use authorization in the U.S. in mid-December, with distribution from the federal government to states beginning within days of that clearance. Both vaccines are 2-dose regimens, with Pfizer shots to be given 3 weeks apart and Moderna's 4 weeks apart. CDPH notes on its vaccine dashboard that the 2.18 million vaccine doses it has distributed include both first and second doses. A primary debate in the U.S. has been whether second doses should be held back in reserve for those who received the first, or if we should administer as many doses as quickly as possible. The first option is slower, but guarantees regimens will remain on schedule. The second effectively doubles the speed of the rollout, but introduces risk in the event that there are problems in the manufacturing or distribution chains for either vaccine. President-elect Joe Biden reportedly plans to switch the U.S. to the second option, with his administration releasing most withheld doses soon after he takes office next week, CNN reported Friday. Prior to that news breaking, Newsom also expressed support for giving as many first doses as possible. For many of us, all of us, I think, I want to see 100% of what's received immediately administered in people's arms, Newsom said in a news conference early last week. So that's what's happening with the vaccine right now, y'all. So we're gonna step it up. We're gonna keep stepping up the efforts. So we appreciate all of our frontline healthcare workers. It's a beautiful thing that they're doing and working hard. We've had some of the frontline workers out here on the show, and we just continue to appreciate everybody working so hard on the front lines, especially under all of these like wild conditions. You heard me just read off the ICU availabilities that are going on, and just if you got it, send a cake or some donuts or some cookies over to the ER, to the ICU nurses. You know what I mean? Let them know that we love them and that we're thinking about them. I got a lot of friends out there who are doing that work. So we really, really, really appreciate them. So that's the weekly Rona update, y'all. So now we're going to get into the latest health news. So before we even start, right, before we get too deep into doing stories, we wanted to talk about what community health actually is, what it looks like. What do we mean when we say community health? So got a couple of graphics here that we're going to talk about, because a lot of things add up to what community health actually is, right? And here's some socioeconomic factors that drive health outcomes, right? And this is economic stability, neighborhood and physical environment, education, food, community and society and social context, the healthcare system. And you see that racism and discrimination reach across all of these things, right? So you can see from employment and housing to literacy and food security to health coverage to exposure to violence and trauma, all of these things contribute to our health. And they contribute in different ways, right? So how much does everything contribute? And this was a very interesting graphic that I found. Well, I didn't find it. Netta found it. And we're going to get into that in a second. So this is factors of overall health and how much they actually affect things, right? So, the clinical care is only 20% of overall health, right? Health behaviors, social and economic factors, physical environment, these things all contribute, right? So there's a lot of factors to community health. So on this here show, we're going to talk about a lot of those factors and how all of those factors kind of play a role in the overall community health and what community health looks like. So you just heard me talk about how Netta found this. Y'all, I have an incredible research partner who's been working very hard. She's the medical professional behind this show. I'm just a talking head. And this is one of my favorite new segments. Y'all, this is Netta Found This. So we were talking about community health and what community health looks like. And Netta started talking about upstream health and really focusing on this idea of upstream health. And I was like, Netta, what is upstream health? How does this work? What are you talking about right now? Break it down for me. And then Netta found this.
It was that we put in place a system that allowed us to routinely ask questions like Veronica and hundreds more like her about the conditions that mattered in her community, about where health and unfortunately sometimes illness does begin in places like South LA. In that community, substandard housing food insecurity are the major conditions that we as a clinic had to be aware of. But in other communities, it could be transportation barriers, obesity, access to parks, gun violence. The important thing is we put in place a system that worked. It's an approach that I call an upstream approach. It's a term many of you are familiar with. It comes from a parable that's very common in the public health community. This is a parable of three friends. Imagine that you're one of these three friends who come to a river. It's a beautiful scene, but it's shattered by the cries of a child, and actually several children in need of rescue in the water. So you do, hopefully, what everybody would do. You jump right in along with your friends. The first friend says, I'm going to rescue those who are about to drown, those at most risk of falling over the waterfall. The second friend says, you know what, I'm going to build a raft. I'm going to make sure that fewer people need to end up at the waterfall's edge. Let's usher more people to safety by building this raft, coordinating those branches together. Over time, they're successful, but not really as much as they want to be. More people slip through, and they finally look up and they see that their third friend is nowhere to be seen. They finally spot her. She's in the water, she's swimming away from them, upstream, rescuing children as she goes. And they shout to her, where are you going? There are children here to save. And she says back, I'm going to find out who or what is throwing these children in the water. In healthcare, we have that first friend. We have the specialist. We have the trauma surgeon, the ICU nurse, the ER doctors. We have those people that are vital rescuers, people you want to be there when you're in dire straits. We also know that we have the second friend. We have that raft builder. That's the primary care clinician, people on the care team who are there to manage your chronic conditions, your diabetes, your hypertension, there to give you your annual checkups, there to make sure your vaccines are up to date, but also there to make sure that you have a raft to sit on and usher yourself to safety. But while that's also vital and very necessary, what we're missing is that third friend. We don't have enough of that upstreamist. The upstreamists are the healthcare professionals who know that health does begin where we live and work and play, but beyond that awareness is able to mobilize the resources to create the system in their clinics and in their hospitals that really does
All right. So it looks like I'm back live. Having a little bit of a glitching issue going on over here on this end. I think it's a Facebook issue. I read a little bit about that this afternoon on StreamYard. So hopefully Facebook keeps it together right now, because I want to go into my new other favorite segment of the show. This is called the Racism Crisis, y'all. Yeah. So, for those of you who don't know, earlier this year, San Bernardino started it off this summer, declaring racism a public health crisis. They were followed by 83 counties nationwide, including all over California, in an effort to get it declared a lawmaking emergency. So we are going to continue to have these conversations around racism as a health crisis. This article comes to us from Danielle Renwick of The Guardian, January 5th. Last spring, New Jersey emergency room nurse Maritza Beniquez saw wave after wave of sick patients, each wearing a look of fear that grew increasingly familiar as the weeks wore on. Soon, it was her colleagues at Newark's University Hospital, the nurses, techs, and doctors with whom she had been working side by side, who turned up in the ER. By the end of June, 11 of Beniquez's colleagues were dead. Like the patients they had been treating, most were Black and Latino. We were disproportionately affected because of the way that Blacks and Latinos in this country have been disproportionately affected across every part of our lives, from schools to jobs to homes, she said. Now Beniquez feels like a vanguard of another kind. On December 14th, she became the first person in New Jersey to receive the corona vaccine and was one of many medical workers of color featured prominently next to headlines heralding the vaccine's arrival at U.S. hospitals. It was a joyous occasion, one that kindled the possibility of again seeing her parents and her 96-year-old grandmother who live in Puerto Rico. But those nationally broadcast images were also a reminder of those for whom the vaccine came too late. COVID-19 has taken an outsized toll on Black and Hispanic Americans, and those disparities extend to the medical workers who have intubated them, cleaned their bed sheets, and held their hands in their final days. A KHN Guardian investigation has found people of color account for about 65% of fatalities in cases in which there is race and ethnicity data. One recent study found healthcare workers of color were more than twice as likely as their white counterparts to test positive for the virus. They were more likely to treat patients diagnosed with COVID, more likely to work in nursing homes, major coronavirus hotbeds, and more likely to cite an inadequate supply of personal protective equipment. In a national sample of 100 cases gathered by KHN and The Guardian, in which a healthcare worker expressed concerns over insufficient PPE before they died of COVID, 3/4 of the victims were identified as Black, Hispanic, Native American, or Asian. Black healthcare workers are more likely to want to go into public sector care where they know that they will disproportionately treat communities of color, said Adia Wingfield, a sociologist at Washington University in St. Louis who has studied racial inequality in the healthcare industry. But they are also more likely to be attuned to the particular needs and challenges that communities of color may have, she said. Not only do many Black healthcare staffers work in lower resourced health centers, she said, they are also more likely to suffer from many of the same comorbidities found in the general Black population, a legacy of systemic inequities. And they may fall victim to lower standards of care. Dr. Susan Moore, a 52-year-old Black pediatrician in Indiana, was hospitalized with COVID in November, and according to a video posted to her Facebook account, had to ask repeatedly for tests, remdesivir, and pain medication. She said her white doctor dismissed her complaints of pain, then she was discharged only to be admitted to another hospital 12 hours later. Numerous studies have found Black Americans often receive worse medical care than their white counterparts. In March, a Boston biotech firm published an analysis showing physicians were less likely to refer symptomatic Black patients for coronavirus tests than symptomatic white folks. Doctors are also less likely to prescribe painkillers to Black patients. If I was white, I wouldn't have to go through that, Moore said in the video posted from her hospital bed. This is how Black people get killed, when you send them home and they don't know how to fight for themselves. She died on December 20th of COVID complications, her son Henry Muhammad told the news outlets. Along with people of color, immigrant health workers have suffered disproportionate losses due to COVID-19. More than 1/3 of healthcare workers to die of COVID in the U.S. were born abroad, from the Philippines to Haiti, Nigeria, and Mexico, according to a KHN Guardian analysis of cases for which there's data. They account for 20% of healthcare workers in the U.S. overall. The inequities in COVID infections and deaths risk fueling distrust in the vaccine. In a recent Pew study, around 42% of Black respondents said they would definitely or probably get the vaccine, compared with 60% of the general population. This makes sense to Patricia Gardner, a Black Jamaican-born nursing manager at Hackensack University Medical Center in New Jersey, who's been infected with the coronavirus along with family members and colleagues. A lot of what I hear is, how is it that we weren't the first to get the care, but now we're the first to get vaccinated, she said. Like Beniquez, the nurse in Newark, she was vaccinated on December 14th. For me to step up to say, I want to be in the first group, I'm hoping that sends a message, she said. Beniquez says she felt the weight of that responsibility when she signed on to be the first person in her state to receive the vaccine. Many of her patients have expressed skepticism over the vaccine, fueled, she says, by a health system that has failed them for years. We remember the Tuskegee trials. We remember the appendectomies, reports that women were forcibly sterilized in a U.S. Immigration and Customs Enforcement detention center in Georgia. These are things that have happened to this community, to the Black and Latino communities over the last century. As a healthcare worker, I have to recognize that their fears are legitimate and explain this is not that, she said. Benika said her joy and relief over receiving the vaccine are tempered by the reality of rising cases in the ER. The adrenaline she and her colleagues felt last spring is gone, replaced by fatigue and wariness of the months ahead. Her hospital placed 11 trees in the lobby, one for each employee who has died of COVID. They've been adorned with remembrances and gifts from their colleagues. Each day, we remember our fallen colleagues and friends as the heroes who helped keep us going throughout this pandemic and beyond. That's hospital president and CEO Dr. Sharif El-Nahal said it in a statement. We can never forget their contributions and their collective passion for this community and each other. Just outside of that building stands a 12th tree. It's going to be for whoever else we lose in this battle, Benika said. Y'all pay attention to what's going on, you know what I mean? And how different communities are affected by this differently, and how that's a product of systemic inequity, systemic racism, and it goes across everything, right? It's across every field. So it's definitely, it exists in the healthcare field as well. And that's what we are trying to combat here by having some of these conversations. So that has been the racism crisis. And now, without further ado, we are going to bring on the man of the hour here at Masked Up. He's a doctor. He's a senator. He's the son of immigrants. He's a small business owner, and he's a Libra, y'all. Welcome, Dr. Richard Pan, to the show. Hello, Dr. Pan.
Hello. Good evening, Andrew.
And how are you doing? First and foremost, what's the weather like over where you're at?
Well, personally, I'm doing all right, but I think as you've been talking on the show, it's not good outside when it comes to COVID, and we've got to figure out how we can work together to turn that around.
Absolutely. So your history and work really inspired ProtectUS to do what they're doing. So they were like, yo, let's have him on the show first. Let's have him as the first guest. Can you tell us a little bit about your path as a physician? And then like how do you define community health?
Sure. Well, I actually was very interested in medicine when I was very young. Interestingly enough, when I was in elementary school, I read about blood and how white blood cells fought infection. And in fact, then later volunteered in an allergy and immunology lab and decided I wanted to be a doctor, and actually majored in biophysics in college and said, I'm going to try to work to find the next great cure, right? And looked at molecular biology and a lot of all that really sciencey stuff around DNA and other types of things. But also as I was going through my preparation for medicine and through my training, I also recognized that while it's certainly important that we identify and come up with new cures for the various diseases we have, that those cures don't really work unless people actually get them, right? And that as much time and effort as we spend trying to develop a cure, we need to spend that time and effort to figure out how people get them, right? And then also how do we go upstream as well? How do we prevent people from getting sick altogether? And so that was my career trajectory. Actually, I ended up spending some time at community health centers. I was actually in Philadelphia during the big measles outbreak in 1991. Went out of training, really tried to develop educational programs to get doctors out in the community, and that's how I ended up at UC Davis in Sacramento, which is where I live and represent now. This is actually saying, what can we do to help doctors learn more about community and how we can improve our communities, be good partners with people. It really is about the grassroots, though. So we didn't teach doctors to go into communities and tell people what to do. We taught them how to partner with the people who lived in the community, and how do we make that community healthier? What are some of the things we could do to share their knowledge and expertise, but also to listen to the community as well and figure out how do we partner to make sustainable change. And that was really what I was doing before I got into elected office. And frankly, that's what I continue to do through the policies I work on as a legislator.
Beautiful. So what would you say in your opinion is the biggest threat to community health right now?
Well, the biggest threat to community health may be people being divided and not able to work together, that we politicize public health, that we let our divisions prevent us from coming together to solve those problems. One of the things about community health is that, and about health in general, is that, well, a lot of times people view health as an individual characteristics. You know, I'm healthy, I'm not healthy. It really is a community characteristic, right? No matter what you do as an individual, you can try to improve your situation, of course, for yourself personally and for your family, but the larger community's health actually has a big impact on your own health. In fact, we talk about the fact that your zip code can decide what your life expectancy is. And when we talk about racism as a public health crisis, it also often has to do with the way not only individuals are treated, but the communities in which they live are treated. And I can certainly give many examples, but it is about, community health is about when we all come together. And if anything, this COVID pandemic reminds us of this, right? We have a contagious virus that spreads from person to person. And actually, one of the biggest challenges is that one of the things I taught about community health is how do we build more connections between people so we can get more supports between people, right? So we want to build that social capital, build that networking between people. But yet at the same time, when it comes to a contagious virus, it's not so much connections, but physical contact or physical proximity is one of the things that helps spread this virus. So how do we remain connected in a way that doesn't allow a virus to spread throughout our community and then infect people?
Right. Well, and on the topic of the virus, you know, what are your, you heard me read the story earlier about the rollout and what's going on with the vaccine. What are your firsthand, you know, you're the experienced medical professional here. So what are your observations and feelings around the COVID vaccine?
Well, the COVID vaccine will work in two ways. So first of all, it does provide individual protection. And we've done the studies to show this. The clinical trials have demonstrated the two vaccines that we've approved are 95% effective. That's great. By the way, 95% means 1 in 20 people could still get the disease, even though the vaccine itself actually will make that disease less severe. So it still has a benefit even for people who catch COVID. But the other part about vaccination that we have to keep in mind is that when enough of us get vaccinated in a community, we can create a situation we call community immunity or herd immunity, which actually not only provides protection for the individuals who got vaccinated, it provides protection for everyone, including people who cannot be vaccinated. There may be people who are too young. So for example, right now, the COVID vaccines are not approved for people under the age of 16. So essentially our children. We think eventually it will be, but there'll be people for whom the vaccine may not be recommended, right? You may have an allergy to something, you may be too young, there may be other reasons. And we need to protect those people as well. And the vaccine can actually do that if the rest of us who can be vaccinated are vaccinated. And so with both of those, we can actually stop this pandemic.
Beautiful. So you're one of the more outspoken public health advocates out here in California. Why do you think it's important? Number one, why did you think it was important for you to be a public health advocate? But why is it important for the rest of us to also be public health advocates?
Well, as I said before, the health of any one of us is dependent on the health of all of us, right? So that's why it's important to advocate for public health. And public health really is about how we can work together. because oftentimes the threats to our health look for weaknesses in that division that between us, right? So whether it's a contagious virus, whether it's other types of disease entities, oftentimes when we are divided and we don't work together, then a disease finds its way to be more successful, or for our perspective, not so good, right? More dangerous. And so we did talk about vaccines, but let's also talk about masks and physical distancing, right? And so, you were running off some pretty depressing statistics here, right? And we're watching our hospitals get overwhelmed. And so the question is that, well, what can we do about it, right? Well, what we can do is work together to do the basic things that we can to stop the spread of this virus. So things like wearing a mask, trying to stay at home as much as possible, recognizing that there are some people who are essential workers who have to continue to go out, try to limit the amount of spread. If you're positive or exposed, try to be isolated. Don't go around potentially spreading it to other places. At the same time, those of us in public policy need to help make it easier for people to do that, right? So, if you're worried about losing your home and starving or other types of things, we need to provide you the support so you can stay at home. We need to provide the support to the businesses so they can survive, right? If you're going to lose the business you've spent so many years trying to build up because of this, we need to do that. But ultimately, in the end, well, most people are doing these things, struggling with it, but are doing these things. It just unfortunately takes a small number of people, just enough of them, to actually ruin it for all the rest of us, right? And that's one of the challenges of public health. And we see this also with vaccinations as well. Even when a very large majority of people do what they can, it only takes a small number of people who don't to basically blow it for all the rest of us. And that's one of the biggest challenges of public health. That's one of the biggest challenges of conquering this pandemic is that we really do need everyone on board. We're all in it together. And so when we do have people who say, I don't care what happens to other people, I want to do what I want. We've got to figure out how we convince them and remind them that their actions or their inaction, depending, it is actually putting the rest of us at risk. And that's one of the biggest challenges of public health.
Absolutely. Absolutely. So we come into the end of this, but I have one question that I ask every guest that comes on this show. And that is, where's your joy at? Where are you finding joy these days?
Well, actually, there's many sources of joy. Certainly my family is a very important source of joy. And I want to acknowledge that, for example, this latest surge does come partially from people missing their family and wanting to travel and keep family traditions and so forth. And that's difficult, right? Because we have to figure out how to redefine these in a way that doesn't actually endanger the rest of our family and our community. We also need to find joy in each other. So I know that they use the term social distancing. I really talk about physical distancing because we still need to connect with each other. That's so important to our health to be able to connect with each other, but we have to do it in a way that's safe so that we're not endangering other people and they're not endangering us, right? So how do we continue to be connected in a way that still allows us to have joy in each other without having that physical risk? And hopefully, our ingenuity has allowed us to have this vaccine or these vaccines that can, if we all work together, eventually allow us to be more free of this pandemic. Now, I'll remind you that people still need to wear masks, keep their distance, but as more and more people get vaccinated, we're going to be able to relax a lot of things so we can do more things together more safely. And so let's get there as well. So we have that hope on the horizon, but that hope will only get here if we all work together to make it happen.
Absolutely. I love to joy hunt with people. You may be the most prestigious person that I've ever gotten to joy hunt with. I'm really excited about this. I got to joy hunt with a California senator, y'all. So I just want to thank you for being on the show, for coming and talking to us, and for all the work you're doing out on the front lines. Really appreciate you, and we'll have to have you back sometime.
Okay. Well, thank you so much, Andrew, for inviting me to be with you.
Absolutely. Have a great one.
All right. Thank you.
Y'all, that's one in the books. That's episode, this is Masked Up 2.0, episode number 1 in the books. Man, big shout out to ProtectUS. Big shout out to Dr. Richard Pan, Senator Richard Pan, Libra Richard Pan. And we'll be back every Monday night at 8:08. Keep up with me. I'm Andru Defeye, Andru Defeye. And you can find me on Facebook. You can find me on Instagram. You can find me all over the internet. And man, it's been an absolute pleasure. And I'm going to leave you with a little bit of love from my homie MC Zeps and his daughter Sully. And y'all have a good week and stay healthy out there. Stay masked up.
All right, so bring that mask over here, right? Hey, yo, check it out. That's a yummy cake. Listen to me, or I'll say it fast. If I can't take a bite if I put on my mask, but it's okay, cause you heard me. To go on a journey, you don't want to catch those sticky journeys.
No, I need to wear a mask.
Yes, to keep you safe. You gotta cover your face. Anytime you go outside in the place, you gotta be safe. Was that a burp? That was cool. She's a good girl. She does so good in school.
The one named at home, I can't wear a mask. I can't be sick. I need to not wear a mask only at like school
or stores. That's true. Keep your social distance. Listen to the rhymes just for instance. Thank you very much. Don't forget to wear your mask on your nice little smile. That was Sully and